Alright, carpal tunnel syndrome. It is something we all have probably heard of. It's the most common neuropathy of the upper extremities. It comes easily and doesn't always feel that great. But what exactly is it? Well, let's start with the general anatomy of the upper extremities. The carpal tunnel is the transition from your wrist to your hand. Through that tunnel, a lot of blood vessels run through, 9 tendons run through for the movement of the hand and fingers, and the median nerve runs through. The median nerve helps control movement of the forearm and the hand, and is both a motor and sensory nerve. It gives sensations to the palms and the fingers. That's what makes it a sensory nerve, and for the movement of the hand, wrist, forearm, that's how it is a motor nerve. Now, pressure on any nerves can cause uncomfortable feelings and pain, and so carpal tunnel syndrome occurs when there's too much compression on the median nerve. Symptoms of carpal tunnel syndrome is pain in the wrist, usually about 3 fingers, including the thumb. The pain in the wrist can travel all the way up to the forearm, where the median nerve begins. You can also have a tingly feeling in the hand and fingers, a sensation similar to what we call your hand falling asleep, all those needles in there, that feeling. That sensation can last longer and more uncomfortable with carpal tunnel syndrome. Now, there's only a narrow list of possible causes of carpal tunnel syndrome. It can be from a long period of time of either no movement or a lot movement in the same direction, the same motions of the hand or the wrist or forearm. Typing on the computer frequently every day for a lot of the day, that is a common cause of carpal tunnel syndrome. Also, people with prior wrist injuries, they're also more susceptible to developing carpal tunnel syndrome. So for diagnosis of carpal tunnel syndrome, there are a few ways to do it. Usually with clinical diagnosis, there can be what's called the Phelan's test. This is where you have your elbows on the table at about a 60-degree angle. Then with the wrist in full flexion, the back sides of your hands are pushed together, and you are held in that position for about 30 to 60 seconds. The patient would test positive with paresthesia, causing pain and abnormal sensation from nerves there. The medical professional would record the time it took for that pain to appear. There's also the reverse Phelan's test, very similar, arms at full extension, shoulders in neutral position, and this one, your palms would be placed together and also held in that position until pain would arrive, if it would. Now, who does get carpal tunnel syndrome the most? Well, the prevalence of it can be found about 3 to 6% of the general population developing carpal tunnel syndrome. A lot of research is still being done to find out the actual history, who can get this the most. It has been said that females are more likely to develop carpal tunnel syndrome, especially during pregnancy. Due to frequent hormonal changes, this increases fluids throughout the body, and this can lead to swelling, causing more compression on the median nerve. Not much knowledge on genetics is being studied. It is being studied right now, a lot to learn. But how do we treat carpal tunnel syndrome? The patient's wrist probably will be in a metacarpal splint to resist movements and provide support for those muscles. A very common treatment is the injection of corticosteroids, or cortisone, into the wrist. This can be ultrasound guided to locate the part of the carpal tunnel needing the most pain relief. Tendon gliding exercises also can help. That is movement to the wrist and the fingers to loosen up the tendons there, to take compression off of the median nerve. There isn't enough evidence proving the efficiency of these exercises, but they are ultrasound guided sometimes, and it's easy to work with to relieve a little bit of the pressure there. A lot is still being studied about carpal tunnel syndrome. A lot more to know. Let's all have good hands and wrists.